Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates, and welcome to the Paramena Bliss Podcast. And today I want to talk to you about blood pressure, and specifically low blood pressure. So a lot of times in the medical system, they don't ever seem to be as worried about low blood pressure. But the thing is that because I have so many clients that come in and fatigue is one of their main concerns, low blood pressure can be a major cause of fatigue. So we want to make sure that we're not just thinking about, is the blood pressure too high from a cardiovascular risk, but if your blood pressure is too low, that is a problem too. For instance, I had a client recently, and they were sitting across from me, and their chief concern when I looked on their form was fatigue. So I started asking them about their sleep, which was good. Their sleep was actually amazing, so it wasn't that. They wanted to exercise, but they were honestly just too tired to exercise. And then I started asking them about thyroid issues. There was no thyroid issues. They had all that checked. They were taking B12. So then I asked about their blood pressure. And they said, oh, my blood pressure, my nurse and doctor said my blood pressure is amazing. And I was like, oh, well, that's great. Well, what is it? And she said, it's 100/62. They said, I have no risk for heart problems. And I was like, well, that's that you don't really have a lot of risk for heart issues per se, but you can't really have good energy and have a blood pressure of 100/62. And she's like, really? And I was like, well, I bet that your energy drops, and I bet you get dizzy when you stand up, don't you? And she said, well, yeah, exactly. And I said, almost dizzy enough that it's almost like kind of your vision goes a little, blurry a little bit. She's like, yeah, that's pretty much it. The main thing we had to work with her to get the improvement was to improve her blood pressure. It was just way too low. So again, optimal blood pressure is 120/80, but being way lower is not better. Just like being way higher is not better. In fact, I would feel like if we had to do like a plus or minus 10 on that, like say 120/80 is the optimal. If you went down 10 points to like 110/70 versus up 10 points to, well, I don't like the 90, but say 130, if your blood pressure was 130 instead of 120, then most people would feel a lot better at the 130 than they would at the 110. That is for sure. So again, dealing with the blood pressure, we're trying to get that 120/80. If I was to give a range, I would say anywhere from 115 to 130 is where I find people feel a lot better at than is if they go lower than that. Now the next point I want to talk about is something called orthostatic hypotension. So this is exactly what that patient I had was experiencing. This is when you stand up quick and you get dizzy. So beyond your resting blood pressure, which is the only thing that they typically take, is that when you stand up quick, your blood pressure should actually increase a little bit, and that stops all of the blood from just running down and pooling, and that extra tension in the arteries and veins, it stops that just downward flow, so that way the blood doesn't all rush away from your head. So if that's not happening, so what you can do for that is that you have someone lay down, you take their blood pressure at rest, and then you have them stand up really quick, and literally as they're standing up, you start priming up that cuff, take their blood pressure, and their blood pressure should go up. Like if they were 120, it should go up to probably at least 125. And you should see that jump in blood pressure. If you see that it doesn't jump, or even more so if it drops, if the blood pressure drops on standing, then we're dealing with something called orthostatic hypotension, so low blood pressure on standing. So this is something that you see very commonly when they've just been overworked, stressed, and burnt out. And we would attribute, in naturopathic medicine, we attribute this a lot to the adrenal glands. So in those situations, we would be doing a lot of work to help stimulate the adrenal glands. Now, if it's low already and then gets even lower when standing, then you're dealing with adrenal glands, and then you've got to do other things to just improve the regular resting blood pressure too. So let's talk about that next. The obvious one that you're probably aware of is salt. Getting more salt in your diet. As people have become a lot more health conscious, one of the things that's been kind of demonized is salt. But salt is actually really important for you, especially too if you can get like a good salt with a lot of trace minerals and different sea salts. And make sure you get something with iodine in it too, because people are like, well, everyone knows that you get tons of salt in food now. And that's true, especially if you're doing a lot of canned foods, packaged foods. They do add a lot of salt. Now keep in mind they don't have any iodine in it. It's just sodium. But the thing is, most people are health conscious. They've been avoiding those foods because a lot of packaged processed foods aren't good for you. But then they've also been avoiding salt. So you do still need, especially too if you're exercising and you're sweating, you need to replenish your salt and your electrolytes. So add some salt to your food, get some sea salt, add that to your food, and consider adding any other. For instance, I've talked about this before, but I always try to get people to use things like seaweed chips because they do have the salt that you need, and they have a lot of other trace minerals and nutrients in them. So anything you can do to get your salt levels up and your mineral levels up if you're dealing with low blood pressure is important. Another thing that can contribute to low blood pressure is anemia. So if you don't have enough blood volume, you can't have enough blood pressure. So in the next talk, I'm going to dive into anemia, so tune in for that. But one of the things you need to be aware of is that if you're having problems with low blood pressure, make sure you get your iron levels checked. Make sure you get your red blood cell levels checked and your B12 checked. Okay, so we're just going to put that out. We'll dive into that more on the next episode. And finally, one of my absolute favorite things to give for low blood pressure is licorice extract. And the reason is that licorice can help improve your blood pressure. Now, if you're taking massive amounts of it for a prolonged time, and it's a very small percent. Actually, I've never even seen it. But it can increase your blood pressure too much. But I have to admit, in practice, I've never even seen that happen yet. And I've used licorice for a long time. So licorice extract is great because 1, it can improve your blood pressure. 2, it's great for adrenals and for adrenal burnout. 3, it's anti-inflammatory. And it can help with estrogen balance because it has phytoestrogens in it. And phytoestrogens are great in perimenopause. So, I hope this kind of helped dispel the myth that the answer to blood pressure is lower is better, because it's not. It's about being, like everything else, it's always about being balanced. So I hope you can take this information. If you're struggling with feeling fatigue, make sure you check your blood pressure from laying down, standing up, all of those things, see what the numbers are, and you can get that corrected and get your energy back. All right, this is Doc Yates, signing off.
Thank you for tuning in to the Paramena Bliss podcast. Don't forget to hit the subscribe button and visit paramenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Paramena Bliss podcast.